Thank you, Madam Chair. I want to lock in on prior authorization for a second. And my first question is for Dr. Durham. Prior authorization is the #1 administrative burden facing physicians today across all specialties. Prior authorization, the #1 administrative burden facing all physicians across all specialties. As a physician myself, I knew of the frustration of having to do this, talk to a person who maybe a non-specialist who wasn't from my area. So I couldn't imagine trying to do a prior auth with you on a patient in the ER, your years of experience. And as an obstetrician, I'm trying to tell you who doesn't need inpatient management. Couldn't imagine doing that. But this burnout's leading to early retirement. It ties up nurses. It's frustrating to nurses as well. It makes us all less productive. I guess and you spoke about this earlier, prior authorization. My question is, do you ever feel that prior authorization is used to ration care or to delay the care the patient needs?
Thank you so much for your question. And as a fellow physician, that you understand sort of what we're going through. I do think it delays care, absolutely, especially in the emergency room context. We have literally 2 to 3 hours sometimes just to get someone a bed because we're waiting for the insurance to respond to give the okay that yes, what you have presented to us meets the criteria for us to get a patient an inpatient psychiatric bed. So without a doubt, it delays care. And when we're thinking about an emergency room, we have a lot of patients we need to see. I talked briefly in my testimony about we've been beyond capacity in our emergency rooms, and I think that that's not unique to BMC, but across the nation during this crisis that people are going in for emergency services. And so awaiting beds, awaiting placement just, clogs the system, if you will.
Thank you. My next question for Dr. Prinstein, and we're going to stay on the same subject of prior authorization. If there was a streamlined solution, would it be helpful to your specialty? Streamlined meaning, I would suppose that 10 diagnoses account for 80 or 90% of the issues that need to be prior auth. We have Senate Bill 3018. It's bipartisan, bicameral as well. We have 17 sponsors, including 8 Democrats, 9 Republicans, 450 national and state organizations are sponsoring this legislation, which would streamline the prior authorization. Would it be helpful for members in your specialty?
Yes, I think it would, and thank you. Psychiatry represents, of course, a small percentage, just 10% of the mental health workforce. The rest of us are psychologists, social workers, counselors, marriage and family therapists, and thinking of solutions that include all mental health providers is appreciated. Thank you.
You bet. My next question for Ms. Goldsby. You work in the Department of Alcohol and Drug Abuse Services. Does prior authorization ever impact your patients? Especially, does it delay care or ration care?
Senator Marshall, we do sometimes see prior authorizations delaying care, particularly for some patients who have insurance benefits when they're needing to be placed on medications.
And a streamlined approach to those patients would be beneficial to your staff?
Yes, absolutely. No barriers to treatment, yes.
Okay. Dr. Lockman, kind of the same issue, prior authorization in your world. I know you're doing research, more research-based. Do you ever sit there and think about some of what your research leads you to, that will patients have access to it? Are you worried about an insurance company deciding as opposed to evidence-based medicine deciding what that patient should be receiving?
Absolutely, I concur. Every single hour that we spend navigating pre-authorization to get a patient the evidence-based treatment that he or she needs is an hour that could be spent on something else. Delivering the care that changes people's lives. It could be spent on also doing the training that you'll have mentioned is critical. So I think any way that we can cut down on the processes would be helpful to where we can just give people the treatment that they need.
Okay, thank you so much.